Health officials in Washington state said today that 4 more people have died of the new coronavirus, bringing the state's death toll to 6 now. Closer to home, the infectious disease specialist at Missoula City County Health Department tell MTN's Russ Thomas it's only a matter of time before Montana sees its first case.
The spread of coronavirus, also known as COVID-19, is being matched by the spread and fear of the deadly disease worldwide. So far, there are no known cases in Montana. However, a recent change in how potential cases are being tested will likely change that statistic.
The CDC was the only place in the country as of last week that was testing. Late last week, that changed. The FDA said, no, we'll let other kits be used. Much like what we had last year with pertussis, if you start testing, you'll start finding.
O'Connor says she believes we'll start finding those cases in Montana. While the spread of the coronavirus is worrisome, it's important to remember that there are other much more prominent health concerns.
There are other much more present threats to our health. There are, in the U.S., 32 million cases of flu in the U.S. at this point this season, and there are somewhere between 86 and 89 cases of COVID.
Among those 32 million flu cases are 18,000 deaths. One interesting note to this point, in China, where coronavirus began spreading in December, men by far have been more impacted, with most having other health problems. Women, pregnant women, and children have seen fewer cases. The symptoms of COVID-19 are similar to the common cold. The biggest impact can be found in the lower respiratory system.
Generally a fever and lower respiratory symptoms, which involve a cough and shortness of breath. But the shortness of breath is more than one would feel with a common cold.
As for fighting off contracting coronavirus, O'Connor suggests taking the same precaution used to fight any virus, things we should be doing anyway.
Rub your hands for a good 20 seconds, sing happy birthday a couple times, rinse the germs down the drain. The hand sanitizer is a secondary thing. Try not to touch your face. Pay attention to how many times you touch your face in a day. You'd be amazed.
O'Connor adds covering your mouth when you sneeze and cough are other precautions that should be taken to help avoid the spread of a virus that is almost certain to impact communities around the state in the weeks to come. In Missoula, Russ Thomas, MTN News.
Meanwhile, some stores in our state running low on face masks. It has been a big problem in Gallatin County, but the U.S. Surgeon General taking to Twitter today to tell the public to stop buying the masks. He says the masks are not effective in preventing the general public from catching coronavirus. The increased demand is also preventing masks from getting into the hands of the people who need them the most, healthcare providers caring for sick patients. Governor Steve Bullock will hold a news conference tomorrow detailing plans ahead of any possible spread to our state.